So my name is Lorraine and Jacqui. I'm faculty here at the School of Nursing, and we're here to talk about our psychological safety that we do within our SIM Center. In our SIM Center we have multiple areas, but the area that I'm concentrating on right now is our high-fidelity area, which deals with mannequins. Okay. That are interactive mannequins that breathe and talk to you, and you can listen to all sorts of things. So it's related to a clinical experience for students. Okay? And the reason why we're doing this is because psychological safety is actually very, very important in the simulation center in order for students to be able to learn. Students would like to know what their objectives are. They need a clear understanding of how this center works and whether or not they're going to be evaluated, what their goals are, and those kinds of things. So very similar to what you would have as an activity in a classroom. However, this is more pertaining to a clinical environment. And that being said, our actual briefing, which we call it as a briefing, is 20 minutes in length. So I'm only giving you sort of a very small snippet of some of the information that we share. I work with lots of faculty here, and today I have a colleague of mine who is going to role play the student, and I'm going to role play the simulationist or the debriefer or the facilitator for this particular session. Hi, welcome to the Sim Center.
Hi.
Hi, my name is Lorraine and Jacqui. I'm faculty here, and we're here to talk about simulation.
Okay.
I want to know a little bit about yourself. So can you tell me your name and exactly where you have your clinical placement?
Sure. So my name's Jackie, and my placement right now is complex continuing care in semester 2.
Okay, great. So what we're going to talk about today is a little bit about what's happening, and so a little bit more about me. You have 4 scenarios that's going to happen today,
Yeah.
and those scenarios were designed by faculty
Okay.
to meet the learning needs of the PN semester 2 program.
Okay.
Okay, so there are scenarios that are based at your level.
Okay.
There may be 1 or 2 skills that you may not have covered. You may have been taught it. You may not have had an opportunity to actually do it in clinical.
Right.
So we'll give you a little bit of a highlight about that, but it's not really about
Okay.
teaching. This
Okay.
is about your ability to put all the things that you learned from semester 1
Okay.
and semester 2 and your clinical practice right now,
Okay.
put it all together, and integrate it, and then be able to transfer that knowledge to our simulated hospital setting
Okay.
here. Okay.
Yeah, I'm feeling quite nervous about it. Yeah.
Me too, actually.
Okay.
So that's okay. Having
Okay.
a little bit of anxiety is really good. It helps with the learning.
Okay.
Having too much anxiety means that you probably
Yeah.
won't learn.
Okay.
Now you did see you did sign the consent and see
I
the
did.
video,
Yeah,
right?
I did.
Okay. So to make things a little bit better for you, you will have an opportunity to actually go in and touch
Okay.
and feel the mannequin, because it's different to kind of see it
Yeah.
on the video
yeah.
and then actually be here.
And this is my first time doing
Yeah.
simulation, so I'm not familiar at all with how they work, or, you know.
So rest assured, not to worry. We're going to give you an
Okay.
orientation. We have a technologist
Okay.
here who will show you all of where everything is located.
Okay.
Very similar to, like I said, that you saw in the video,
Yeah, okay.
except it's going to be that you're able to touch it. So you'll take your
Okay.
stethoscope in with you, and you'll be able to, listen to the chest sounds, hear it
Okay.
talk, figure out where's how far, and that
Okay.
kind of stuff, and then
Okay.
be able to come back, and then we'll review the objectives of your scenario.
Okay.
You'll have a time to practice with your partner, because there's 8 of you here,
Yeah.
but usually you don't do clinical. You don't always go into clinical and work in partners.
Right.
You only call them in when you may
When you
need
need
help.
them, yeah.
This is a little bit different. You
Okay.
get to work with a partner.
Okay.
So I'll give you some chance to kind of plan your care.
Okay.
Okay?
Yep.
So a little bit more about how that's going to happen is that you'll have about 10 or 15 minutes
Okay.
with your partner to take care of your client,
Okay.
your patient.
Okay.
And then we'll come back and we're going to sit down and we'll do a debriefing.
Okay.
Now the debriefing is going to involve everybody in this
Okay.
class, okay?
Okay.
Because as you're in there actually doing,
Yeah.
the rest of us are here watching on that screen over there.
Oh.
Okay?
Okay.
And it's only being recorded so that we can have an opportunity to learn from it.
Okay.
This is a learning environment,
Okay.
okay? This is where you're going to take everything that you've learned,
Right.
put it into practice
Okay.
in a safe environment.
So is there any evaluation? Like, am I marked, or is it going to affect my clinical practice? Or
We do not evaluate here. This is
okay.
strictly, if you make mistakes, it's fine, it's
Okay.
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 This is where the mistakes happen. Sometimes you get information in
Yeah.
class that may not necessarily make sense to you.
Yeah.
Or you're not quite sure, you kind of make sense to you, but when you go to actually put it to practice, you're not quite sure how it all goes
Right.
together. This is the area to be able to do all that.
Oh, okay.
Okay? But we're building on your information, you have to transfer. So you are very
Okay.
intelligent. Because you're
I hope
here.
so.
Yes, because you're here.
Okay.
You got to semester 2, you have a wealth of knowledge that you have some tools in your back pocket
Okay.
already. Sometimes we have ability to try and pull those out, especially in
Okay.
different circumstances.
Okay.
And this is an opportunity for you to be able to pull those tools out,
Okay.
transfer some of your knowledge, figure out if it makes sense. If it makes sense, great, and it
Right.
works, it's great. That solidifies your knowledge and your
Right.
ability to keep that.
Okay.
Where the learning comes in is if to try and clear up some of those things that you're not quite 100% sure.
Okay.
Or you have a situation that you've only heard about in class but haven't had a chance to practice.
Yeah.
It's okay here.
Okay.
Mistakes are perfectly acceptable in here
Okay.
because we're all gonna talk about them,
Okay.
okay?
Yeah.
All
That
right.
sounds good.
All right. So that being said, I have a couple of things I need you to be aware of.
Okay.
One of the things is that I'm asking for respect.
Okay.
Now that means that I'm going to respect you, you will respect me, but more importantly, you're going to respect the mannequin
Okay.
and the equipment that's in there and all the
Okay.
staff that work here and all of the others that are sitting around here.
Okay. Sure.
Okay? We've all signed confidentiality forms,
Yes.
which means that this is, because this is about student learning, you can go and talk to other students
Mhm.
about the fact whether you liked it or didn't like it, but in
Okay.
terms about what happened here, what people said,
Right.
the unfolding of the scenario, that has to be kept confidential, just
Okay.
like you do in clinical practice.
Okay.
Okay?
Yeah.
Then it'll be about 10 or 15 minutes, like I said, 45 minutes after, 35 to 45 minutes after debriefing.
Okay.
I'm going to ask questions in a
Okay.
very positive way to
Okay.
try and figure out what your thought process were,
Okay.
to try and make up the links.
Yeah. Okay.
Okay?
Mhm.
And you have a partner, so you have lifelines that's with your
Okay.
partner, and you're allowed to talk over your client
Okay.
here because it helps us and the students that are watching learn.
Okay.
Because while you're in there, they're also in here trying to figure out what they would do in that same situation.
Okay.
Okay?
Yep.
And that's how we all learn from each other.
Okay.
Okay?
Sounds good.
In terms of logistics around here, we have 4 scenarios. We'll
Mhm.
be here for about 4 hours.
Yeah, okay.
We'll give a little bit of a break in between because we're not allowed to eat and drink in this
Yeah,
area.
okay.
And there's also washrooms that we can have, but unfortunately we have to go all the way out and back
Oh,
towards
okay.
the center
To
where the elevators are,
yeah.
but we'll
Okay.
give you time for that too
Okay.
as well, okay?
Alright.
The only thing that I ask is that you participate.
Okay.
You do your very best.
Mhm.
And that if you have questions, please ask them.
Okay.
And be a semester 2 student. So whatever you can do in
Okay.
semester 2, you can do.
Oh, okay. I was worried that actually I was supposed to be like an RPN registered, you know?
Yeah.
So if I don't, I just have to do what
Mhm.
I know.
That's right, exactly
Okay.
what you know, okay?
Okay.
And that, because you learn things, like I said, back in clinical, but I don't expect you to do things that you haven't learned
Okay.
yet.
Okay. That's
Right,
good.
and how you
Yeah.
haven't learned in class either,
Okay.
okay? So this is all about putting all that information you have together.
Okay.
Okay?
And is there gonna be a code blue? Cause that's kind of, we're all worried about that. We've all been talking about it, cause that's kind of what we think about with simulation, so we're kind of nervous.
I can see how you are. So I
Yeah.
guarantee you there is no code blue going to happen
Okay.
today for these
Okay.
scenarios. You're not at that level right
Okay,
yet
that's
that we
good.
want to do.
That's a huge relief, actually.
Yeah, it's a little bit
Yeah.
frightening. Maybe in a
Mhm.
later semesters you may end up finding some of that, but
Okay.
Right now that's not the goal.
Okay.
Okay.
Well, I know that makes all of us actually feel a lot better.
I'm sure I
Yeah.
can appreciate that.
Yeah.
But we do have times where the technology does give out on us here.
Oh,
And
okay.
and it may take a while. So if that's the case,
Yeah.
we'll figure that out
Oh,
at the
okay.
time, okay? But it's
Okay.
not because the mannequin
It's not
acting as the
responsive.
client is
Okay.
not responsive
Oh,
and they've
okay.
had a code situation.
Okay.
Okay?
Yeah.
All
That's
right,
good.
fair enough.
Okay.
So just prior to every scenario, I'll give you the objectives.
Okay.
So that you know what you're doing, and then we're gonna come back and debrief around those.
Okay.
And when we debrief about that, it's not just that it was good or bad that we're
Right.
looking for from the rest of the group too. It's about why. Why do you think it was good?
Okay.
Why was it why would you like to change it?
Right.
How does it impact all those things that you learned about? There's client relationship, communication, you know, the policies and procedures that you have in hospitals, the best practice guidelines. All of these scenarios are designed by faculty to ensure that they incorporate all of those types of information. Okay?
Yep.
Do you have any other questions?
I don't think so, no.
Okay, so then what we're gonna do is make sure to see if the technologists are ready,
Okay.
and then we'll go in and have a review of the stuff and
Sounds
equipment.
good.
Okay?
Okay, yeah.
All right, great.
Okay,
Thanks.
thanks.